Good evening, and welcome to our exciting Facebook Live tonight. Tonight, we have an exciting panel that we're going to be discussing the changing paradigm for sickle cell disease. And it's quite fitting because today is the end of Sickle Cell Awareness Month. And with that, we're going to jump in because we've got a lot to discuss with a wonderful panel. So let me get in first and describe who our panelists are this evening. First, we've got Dr. Ami Patel. She is the Associate Director of the UCLA Health Sickle Cell Program. We also have Tolu Afolabi from the UCLA Sickle Cell Disease Program, and she is a Sickle Cell Disease Program patient warrior, and they're both here together from UCLA. And we have Yvonne Bryant, and she is the lead of hemoglobinopathies at Novo Nordisk. And we share a little bit first about our panelists. Dr. Ami Patel obtained her medical degree from Western University of the Pacific. She completed her medical residency at Loma Linda University and a combined pediatric adult fellowship in sickle cell disease at St. Jude Children's Research Hospital. She started her job at UCLA as the Associate Director of the Adult Sickle Cell Program in 2023. She was inspired by her late sister's battle with sickle cell disease, and she specializes in coordinating comprehensive care, facilitating young adults transition from pediatric to adult care, and advocating for patient-centered, empathetic treatment. Dr. Patel is also a champion for genetic screening and holistic patient support, including through the integration of patient navigation services. Thank you very much, Dr. Patel, for joining us this evening. Tolu Ope, also known as Tolu, is a Nigerian American proudly from Oakland, California. She earned her bachelor's in health sciences with a preclinical focus from CSU East Bay. She grew up dreaming to be a pediatrician. However, her experience as a sickle cell warrior drew her closer to nursing. She holds an LVN license and plans to complete her BSN soon with the hopes to one day earn her DNP. Her passion for healthcare is deeply personal, and she is an advocate for sickle cell awareness through her nonprofit and her work at UCLA. Outside of healthcare, she loves sneakers, Marvel, as well as television and film, and she serves actively in her church, traveling, and loves all things fashion and researching random topics. Thank you so much for joining us, and we really are excited to hear about your patient journey. How are you feeling today?
It's actually an achy day, but I'm managing.
Well, we're glad that you're here with us and pushing through today. We really appreciate that, and we want to hear a lot more about your journey later on today. Next, we're really excited to hear from Yvonne Bryant. She is the hemoglobinopathies commercialization head at Novo Nordisk. With over 20 years of experience in the healthcare space, Yvonne has overseen global clinical trials, supported multiple FDA approvals to address medical unmet need, and stood up product launches to get treatments into the hands of the people who need them. Driven with a heart and a dedication towards helping people live a healthier life, Yvonne now leads a cross-functional team dedicated to advancing Novo Nordisk's 35-year commitment in rare disease innovation, partnering with patients and community members to raise awareness of sickle cell disease, improve access to continuous, coordinated, and affordable care, and to enhance health equity. Yvonne Bryant, thank you so much for joining us today.
Thank you. Thanks for having us. Thank you, Kristen, for hosting the panel, and to the speakers joining. And it's an honor to be alongside you here and have this discussion around sickle cell disease. I think all of us, just even in the introduction, recognize that it impacts thousands of people, and far too long there hasn't been enough conversation. And the sickle cell disease patients and their families, have had to advocate for themselves. And so, this push toward empathetic care and often navigating a system that fails to show up, hopefully conversations like today will help to get us in the right direction, right? Allow us to broaden education for people who need it and really demonstrate both that physical and mental challenge, and hopefully inspire people to take what they learn and put it into some sort of action. So thanks for having us.
Absolutely. I mean, and that's what we really hope for at the end of the day, is to really get people to learn more, to become aware, and to really put that into practice, and really to learn more about the patient journey. I mean, with that, Tolu, I really hope that you can share a little bit about your personal journey with sickle cell. Tell us a little bit about how it's impacted your daily life. Why don't we start with you?
Sure. I feel like it's impacted my daily life in the sense of making sure I cherish each moment along with the people that I have around me and in my life. It's also taught me to be very resilient, not just in health, but in all aspects of my life. I would say it's affected me in a way where I'm also not as trusting with people because of
Mm.
experiences that I've had with my health that has trickled over into my life as a whole. Um, in some instances, it's also caused me to be a little isolated in certain situations, just because growing up, I didn't know other warriors like I know today. And so most of the things that I dealt with, I kept in my head and to myself. So I didn't really open up about a lot of things that I was feeling or that, I had to deal with until some years ago.
Hmm. And how did you get a chance to connect with other warriors?
By becoming an advocate. I would say I think about 2013, I joined my sorority, Sigma Gamma Rho Sorority Incorporated. And through that, I've made friends. And there was a year where I was like, I want to use this platform and use it as a gateway to spread awareness to more people. And so one of my friends was like, think of a hashtag that nobody has used. So I thought of the hashtag I fight for sickle cell. And so it became like a social media like challenge that I did with friends and families and whoever wanted to participate. And through that, I was able to connect with other warriors that were also Greek. And then after that, it just spread into warriors all over. And so now I have so many friends and we can relate to each other and like we experience similar pains or similar journeys. And it's made life a lot better.
That's amazing. And that's one of the ways, I guess, that you're kind of spreading the word and helping people learn more about sickle cell. What do you wish that people knew and understood about living with sickle cell?
Um, I will say two different things. One thing that I wish people knew and understood is that tomorrow is really never promised. I think for some of us warriors like myself that are very resilient, I could be down bad and experience a lot of pain in and out of the hospital. But like maybe a few days later, you might see me out traveling or like dolled up, going out with a friend. And so because they see that, they've developed a resistance to knowing how short life can be for people with sickle cell because I bounce back so easily sometimes. And then the other thing that I wish people would understand is that um, because we deal with so much on our own, it's very hard to ask for help. And so we often tend to feel like a burden. So it helps when people take the initiative to be there without us having to ask.
So I mean, those sound like some really big challenges. I was going to say, are those some of the biggest challenges that you face in terms of like physically, emotionally, or I guess socially? It really sounds like that can be kind of confusing. I mean, you mentioned you had an active life. I mean, you're in a Greek life, so you're out there. It's got to be confusing. People see you out there socially having fun. Is that one of the biggest challenges, or what are the challenges? I mean, obviously, physically, tell us a lot about what do you deal with. You said today was about what number did you say today was
Like
for
my
you
pain
on,
for
on this
today?
your pain level today? Yeah,
It's about 5.
a 5 out of a 10.
Yeah.
Okay.
Um,
So physically and emotionally and socially, tell us a little bit, just give us a snapshot about what is it like living with sickle cell?
yeah. Sometimes it can be hard because sometimes you feel the fatigue or the pain and you can't live up to your commitments. So maybe you have plans to go out with people and you have to flake on them. And so some people that don't understand will be like, "Oh my God, she's just flaking on me again. She's not reliable." While others that do understand will give you the grace to know that it may not be a good day for her. Or like some days, I think one of my hard things is sometimes I just do not want to talk to people and I watch my phone ring. And so people are like, I've tried to call you, but sometimes when you're dealing with the pain, you just want to be alone in dealing with whatever makes you happy and not sitting there and having conversations with people. So that can be a challenge sometimes. I think another challenge often can show up like in the hospital too. Not sometimes we deal with providers that don't understand coming to the hospital is our last resort. And so that can be frustrating for us and draining. And sometimes it develops a form of like PTSD because in a perfect world, we rather suffer in the house in the comfort of our home, in our bed with whatever may bring some sort of comfort, like watching TV or something, versus being in the ER with a bunch of noise and people. Um,
Mm,
Waiting for sometimes the waits are not the best, so it's
mm,
it's easier when people understand the grace of if they came here, I know it's bad because they will
yeah.
tolerate the most at home.
Wow. Dr. Patel, talk to us a little bit about that. I mean, a lot of times people think about heading to the hospital not as the very last resort, but they're thinking they're going to get, the comfort there. Talk to us about the unmet needs you see for the sickle cell community and the challenges you see in your role as a physician working with the sickle cell community when they come into the hospital and what they face.
Definitely. And Tolo definitely highlighted, one of the main ones. I think some of the challenges is sickle cell is a very complicated disorder. It's one point mutation, but yet it causes complete, dysfunction all throughout the body. It affects every single organ system. And I don't think that a lot of, individuals know that, including physicians, about how many complications sickle cell warriors face and how much it can fully affect every portion of the body. And so I think a lot of times when individuals come into the hospital, people are like, oh, yeah, it's just another individual coming in, pain crises, treat. And you forget that there's a lot of different organ damage that's happening at that time. And you're also like, I don't understand why things aren't getting better. And instead of trying to figure out and dig deeper, you're like, it must be the patient. And so, that I think has been one of the biggest challenges that I've seen. And it's not necessarily fully on, the physician or the nurse as well. It's a lot of it is, the way guidelines have been written or the lack of their guidelines. The guidelines haven't been published initially for sickle cell disease. The earliest ones was in 2014. And with still a lot of components missing, and they keep revising and now making some updated, but everything's based on low evidence of research certainty versus things like heart failure or other chronic conditions. There's a lot more evidence, a lot more guidelines, and with guidelines and research, more things can be taught in medical school, in residency and training. And because it still is a rare disease with less research funding compared to other rare diseases, it there's a lot of unmet needs there in terms of education and in terms of just general knowledge.
Well, I mean, that begs the obvious question. Why do we continue to see the lack of investment in sickle cell disease compared to other diseases? Yes, it's a rare disease, but why the lack of investment? And especially we know how hard it hits, Black and Brown communities. Is there a connection at all to that? But just why do we continue to see the lack of resources? 2014 is really late to see those kind of guidelines.
Yes, and no, definitely. I mean, I think you hit it exactly. There is that it affects primarily minority groups. In the U.S., it's mostly African Americans, but it affects brown communities, the Middle East, anywhere that malaria was prevalent. And because of that, there's been a lack of an investment in funding for a long time. And without funding, research does not happen. And so, there in the past 20, 25 years, there's definitely been a huge increase in the amount of funds going towards research to sickle cell disease. But we're starting now versus many other conditions have started 100 years ago in terms of research. So we're well behind most other diseases in terms of funding and research and what we know about this disease.
Wow. Well, so now I know recently I actually was fortunate to make it to a recent conference about sickle cell. And one of the things that I saw was a sickle cell pledge that physicians were taking on how they were going to approach patients. How do physicians contribute to the challenges that sickle cell disease patients face? And what role can education play, or things like a pledge on how physicians can ensure that patients that come in with sickle cell can receive the treatment that they should receive?
I really think that education is key, right? Without knowledge and without physicians understanding all of the things that sickle cell can cause in the body, you won't have an understanding. And without understanding, you can't have empathy. Mm-hmm. And so I think both of those things go hand in hand. I don't think, individuals are out to, not treat patients, right? We all took a Hippocratic oath to do the best for our patients, but without the knowledge there to understand what is best and how best to care for the individuals, it's really hard to do the best job to care for individuals living with sickle cell. And so I think that, it starts with teaching in medical school and teaching in residency as well. But it also is, we need to have more physicians interested and invested in treating individuals with sickle cell disease. There is a lack of adult comprehensive sickle cell programs. And, and even for hematologists, a focus or emphasis on sickle cell disease or benign hematology is not always there. And if you're not training at an institution that sees a lot of sickle cell disease, your education in sickle cell disease will be very lacking as well, even though you are a blood disorder specialist. And so I think that focus on, that education throughout all the training is very, very important, so that, a sickle cell warrior can go to different areas and say, there is a provider who is knowledgeable about my disease and can treat.
That is so true. I mean, yeah, if you're someone who's been trained in blood disorders and you don't have the patients population where you're seeing people that come through with sickle cell, that is something that you're not going to be seeing people with those conditions regularly. But you're right. Empathy is always at the center of so many things that we deal with. Yvonne, you're someone that has had a career so steeped in healthcare and healthcare treatments. We know that empathy is at the heart of what you do. And tell us, why is self-advocacy important to you as a leader in the healthcare space? We know that patient voices are so important, but why is self-advocacy so important to you as a leader in that space?
Yeah, I would say just think about what we just heard from both of them, right? Patient voices are incredibly powerful, right? They're telling a story, their lived experience, their perspectives, and they quite honestly help us to understand the unmet needs, right? Like, what are you experiencing? You telling us today that your pain level is at 5 and you're still showing up, not only showing up for this Facebook Live, but showing up to work, right? And that really, honestly, we can't do anything if we don't listen to each individual patient. And as Dr. Patel had said, sickle cell disease is complex and there are many variable conditions. And when we think about empathetic care, it's also about how HCPs are going to show up in certain instances and understand the pain level and the variation for personalized care, because not every patient is the same. And when we think about tailoring the most effective treatment by the patient, right? That has to go hand in hand by hearing the patient and both the HCP and the patient listening, and partners like us coming in and also supporting where we can, right? Ultimately, as Dr. Patel has mentioned, you want to do what's best, and you want to think about not just the short-term moments, but also the long-term health, which is key. So I would say patients' voices are incredibly important. And if we don't listen, we're not going to be able to change the direction of where sickle cell is going today.
Yeah. Tolu, do you want to weigh in on that? Why do you think self-advocacy is important?
I think it's important because nobody knows your body better than you. I think once you're able to advocate for yourself, then it makes a difference in how people see others. So, for example, if a bunch of patients are going to the same hospital and they're not speaking up, the doctors can't learn if they're not getting, the information that they need from the patient by self-advocating for themselves. So the more you speak up for yourself, the more it helps us as a whole.
Agreed. And Dr. Patel, do you see self-advocacy through the patients that come in, or do you see, when they're coming into the emergency room that, they're dealing with things and the treatment that they're getting, and you're not seeing them advocating, or you're seeing that there's maybe more that patients could be doing?
Yeah, and so it definitely varies on, the individual and the patient when they do present to the ER. But I think, treatment goes beyond the acute care setting as well. And so I, encourage all, and I think, one of the main reasons that I love having Tolu here helping as a patient navigator is that really understands the experience, and can help guide other, patients and to understand what it's needed to be able to self-advocate. So let's help you do, X, Y, and Z at this time. And let's teach you how to do this. So as you continue in your healthcare journey, especially for those newly transitioned pediatrics to adult care, then they'll know how to continue to self-advocate for themselves within the healthcare system, both just scheduling appointments as an outpatient, knowing how to navigate that insurance, and then also when you're going into the hospital in that acute setting, what is it that, you should be asking for? What is it that's, appropriate to do or not do while you're in this healthcare setting? And that first ER visit is going to be a lot scarier on the adult side than it is on that pediatric side. And so just getting familiar and knowing what to expect and having that knowledge as a patient, but knowing, what you can and can't say at that time, is really, really important to just get the best healthcare that you can.
That is so true. And that is going to be very scary that first time for people. What role does, and I'll send this one over to Yvonne, what role does community engagement and patient advocacy play in shifting the conversation?
Well, I would say, first off, historically, people with sickle cell disease are faced with significant stigma, misunderstanding. And so when we look at community advocacy and engagement, it's super critical, right? When we look at some of the physicians who may not be as knowledgeable, right? You touched upon that a little bit, those who may see on occasion, or even when you think about patients who are going to a variety of doctors, right? They're going to a primary care, they may be going to a hematologist or to an emergency room physician. And so when there's gaps, I would say patient advocates are essential to help to bridge the gap, right? They're speaking up on their behalf. And so this notion around getting quality care for patients happens when you have that support system together. And so community engagement, I think, really is just a tool. It amplifies the human element of the person, and it brings to the forefront this need and desire to bridge the connection between the individual and the care they would like to receive.
Yeah, I agree. Tolu, what do you think? Community engagement, patient advocacy. Um, when you go into the emergency room, do you have a plan? Do you have a strategy?
Yes, I do now. So typically, I do have a pain plan that, tells the doctors in the ER what I need. I typically try to go to my ER that is like in the hospital that I see versus a different ER, because once you start going to ERs that don't know you, is when things start to get tricky. I also have a specific set of friends that I contact when it's that time where I need to go to the ER, and find one that may be able to take me and stay with me. So when I can't advocate for myself, they can.
Mm. Have you seen that, Dr. Patel, and in terms of community engagement and patient advocacy, in terms of shifting the conversation? Like, do you find that the patient advocacy is something that's really kind of helping to shift the conversation a little bit more?
It is, and it's really hard, right? So in terms of patient advocacy, it's challenging in that acute setting. So when you're
Mhm.
going and presenting to the ER, it's, like Tolu had said, it's because you went there as your last resort. You tried all the
Mhm.
things that you normally do, and now you're in such severe, intense pain. And advocating for yourself at that point, when you're in such intense pain, it's really hard to, keep that level of, like remembering how to advocate for yourself. And so having that plan and having that community or someone, that support system that can come with you to acute care is really, really important, to have someone else advocate on your behalf. And so, either that's a family member or a friend or connecting with one of your local CBOs in order to have a community healthcare worker that you can call and that can help advocate for you as well is incredibly important in that acute setting.
And does that help with dispelling some of the myths that are out there too? Because I know there are some myths that are out there, and some preconceived notions that need to be challenged that can sometimes impact the quality of the patient care. Does that help with some of the having the patient advocacy groups, and does that help serve as a vital tool?
It does, and so especially when it's going to an ER that doesn't know you, and so
Mm.
you're going, you're either somewhere else and you're not able to get to your local ER that knows you, and you're going somewhere else. Then it's because of all of the stigma and a lot of the just implicit bias and lack of knowledge regarding sickle cell disease as a whole. A lot of times patients can be underdosed with their pain meds in an acute crisis.
Mm.
And, it having that advocate there or a community-based organization advocate is really important to just try to get the care that's truly needed for that individual. And so, and again, when you're in that acute crisis, it's so hard to keep that level of like that calm, and especially when you're not getting the treatment that you deserve.
Yeah.
Having someone else there being able to speak while you're not feeling well is really important.
Absolutely. I mean, if you're coming in at the high end of a 10 scale and being underdosed, absolutely having an advocate there would make all the difference. Um, for Yvonne, I'd love to talk to you a little bit more about Nova Nordis being a thought leader in this space and how important the collaborations between the industry, providers, the patient communities really driving the positive health outcomes that we're seeing out here. Tell us, how important are these kind of collaborations that we're seeing? More and more we're seeing, exactly that. The industry, the providers, and the patient communities coming together and really working to drive these positive health outcomes. How important is that over at Nova Nordis?
Yeah, I would say it's important and to Novo Nordisk and important for um, people and patients in general, right? The collaborations between industry, such as Novo Nordisk, healthcare providers, it's essential. It breaks down silos and barriers when you work together as a team. That's really the force, I think, behind when we want to see, advancing patients' well-being. We couldn't do it alone, and we shouldn't do it alone, right? That's what the physician care team is for. And I would say, quite honestly, a lot of what we are here to do is to listen, first of
Yeah.
all, right? We don't have answers and solutions to things. We listen first.
That's
Um,
that empathy part.
right. Don't come in to solve, like listening
Yep.
and then really trying to say, okay,
Yeah.
what are we learning? And then where do we work together? And I think identifying that to say, so how do we, work as a team to really deliver impact for those who need it most? And that, I would say, is really what our philosophy has been at Novo Nordisk. And when we think about collaborating with others, there's no real way to create lasting change if you don't have collaboration.
Yeah, I mean, I think, it sounds like something that you would think that people would use as that approach all the time. Come listening, be empathetic. But that's not exactly what you expect for every company to do. I think that's something that may set you guys apart. It's like, what do you think sets Novo Nordisk apart in terms of addressing the unmet needs of the
Yeah.
sickle cell community?
Yeah, it's a great question. I would first off just say, this sickle cell disease community, right? They've seen it all. They've heard it all, right? And they've
Totals like,
lived
yeah,
it,
yeah.
right? Right? Like they've lived it, right? And I think there are times, unfortunately, maybe the pharmaceutical industry has retreated when it's been needed most. And you started off at the beginning of this talking about investment and research and support for the community. And I would say we are really, our commitment is, how do we work alongside the patients and the healthcare providers, right? How do we create tangible change? And I would say some of that is thinking about, how does the medical community view people with sickle cell disease, right? How do
Yeah.
we disband some of these healthcare inequities? And maybe part of that is thinking about, how do we talk about things such as pain management or long-term whole health for these patients? How do we amplify messages that are already out there, right? Dr. Patel talked about guidelines. So how do we bring attention to things that need to change? And I would say that's really been our perspective on how we want to set ourselves apart, which is, how do we show up in a way that is respectful and empathetic, but also in areas where we can provide support?
Absolutely. I mean, it's something that is so needed. And I think it feels good to hear you say that, because I know that you're in a position to actually really enact change. Why is it that Novo Nordisk is so passionate about sickle cell disease?
Well, I will say, I think I'm a pretty passionate person in general. People who know me, I try not to be as passionate, but I think in general I am passionate. So it's a great way to describe it.
Yeah.
Well, I will say this for people who don't know who Novo Nordisk is as a company. We have 100 years of clinical excellence in a variety of conditions. And as you
Wow.
talked about it, we've, been in rare disease for 35 years, a long time. Newly entering into the sickle cell market and working, but because we are committed to that and we know what it takes in this space, we want to be real allies and partners in the fight. And so that, I would say, is why we are passionate. I would also say we tend to go with this route of grassroots, working with community, supporting advocates, and I think that part also brings us closer to understanding the realities of sickle cell disease, right? And then also saying, well, how do we leverage our resources or our deep expertise to drive for future, right? How do we look to the future and where is change necessary? And we do a lot of that by, I think, again, listening, understanding, collaborating, and then bringing that to the forefront. So really passionate about being in this space and being able to leverage those years of understanding, what it means to be in a rare disease. And sometimes the rare disease conditions are unfortunately overlooked. So the support is very needed for this community.
Dr. Patel, I know you're just thinking to yourself, absolutely, in terms of the support. When you look ahead and you think about sickle cell and what's needed, we look out, a lot of research funding and everything. That landscape has changed. When you look ahead, and what inspires you about do you see about the future of sickle cell? What inspires you about the future of sickle cell disease? We're coming on off the heels of Sickle Cell Awareness Month. We're talking about the changing paradigm. Let's just talk about what do you think as about sickle cell right now, where we are, where we're going.
I think this is a great time for sickle cell. We have a lot of industry interest and support for creating new treatments and understanding of sickle cell disease, and so we're at the point where I think there's a lot of change that's going to come, and a lot of change that already has been brought to the table. And so even with comprehensive centers, with NASAC, for example, a list of comprehensive centers throughout the United States and that are increasing with new guidelines that are coming up that are consensus guidelines that we've never had before to help providers understand and know how best to treat individuals with sickle cell disease. With gene therapy and all different types of treatments coming out, it's I think it's a very exciting time to be in the space of sickle cell disease, and I'm excited to see where it continues to grow, where research, continues to find better avenues to, treat patients and look at individuals with that comprehensive and holistic approach as well, and making sure that we're doing the most to prevent organ complications so patients can live a long, healthy life.
Excellent. And Tolu, what about you in terms of, you mentioned that the community that you're in, you've reached out. Now we're in this age where social media, you can reach out not just locally and have a local support group, but describe, what is your connection like among other warriors and everything? Are you part of an international group of warriors through social media? Who do you connect with now, and how do you how do you learn about the latest things going on within this community and other warriors?
Yeah, I learned about a lot of things through Dr. Patel, also through social media, just connecting with different organizations. My community definitely is in different areas. I used to have something called Sickle Cell Sundays that I started on Clubhouse. And
wow. What was that like?
It was amazing. And I didn't know how big it would become. It was just a new we were all locked up, and there was this new app, and everybody was using it. I don't know if you guys used it. It's pretty much
I was on Clubhouse.
Yeah, it was like a podcast, but you could participate. Yeah. And so I noticed there was a new platform that Sickle Cell was not on, so I brought Sickle Cell to that space. And because of that, and because everyone was locked up all around the world, everyone was joining from all around the world. And so I made friends in London and Africa that I still talk to this day. And even one of my friends that is in London with sickle cell, I met him for the first time last month, even though we've been friends since Clubhouse in the pandemic. And so that was like a full circle moment. And because of that thing that I started, I was able to connect with people and learn the differences from like UK healthcare versus US healthcare, or, how people experience things with sickle cell in Canada or in Africa. And to me, that's just been a very fulfilling experience because one, I was able to create community for people all over, but two, I was able to learn from other people things that I never knew or never thought about. Like there were some topics that we would discuss and I was like, oh my God, like that's just the complete opposite of my thinking, but it's good to know that that exists and that I was able to learn from other people that come from different areas in this world.
And I'm sure it was the exact same thing for them too. I mean, you guys were sharing different treatments, different conditions, just getting to know each other, and depending where they were, hearing about, just meeting you and your friends. Sickle Cell Sunday sounds great. You got to figure out how to move that to a different platform and get that going again.
Well, I mean, I turned it into a podcast because, of course, once the world opened back up, no one was on the app as much anymore because, we got our freedom back. And so I was trying to figure out a way to bring it back. And so I've been doing podcast episodes, and there's one with Ami in it that was really good. And it's a nice way where people can see others in different areas of the sickle cell community.
Tell us about how do we find it? How do we listen?
It's available on YouTube, Spotify, and Apple Podcasts. If you look up Sickle Cell Sundays, it should pop up.
Oh, we love that. Okay, excellent. Well, I hope everybody listens to you and Dr. Patel.
Thank you.
So yes, absolutely. That is the Sickle Cell Sundays for sure. So what inspires you though? Listening to all of that, now you've talked to people all over the world. You've got the community all over the world. What inspires you about that? I mean, is it just that the community is out there, you're hearing different treatments or ideas, or just communicating with the people? Are you inspired about the future of it, or?
Yes, definitely. I think multiple things inspire me. One, the biggest thing would be the growth of where sickle cell is going. Like Dr. Patel shared, like this is a great time to be in this space. I think my generation and older generations, we didn't really have many options. It was blood transfusions and pain meds, versus now there's so many different things that people have access to. And so like the younger generation of sickle cell warriors inspires me a lot too, because they have so many more options now that we didn't have growing up. And I'm seeing that with the acceptance of sickle cell, I would say, in essence, in the world now, that it's been easier for more people to speak up. So I know a lot of older warriors who say like, I went 40 years without telling anybody I had sickle cell, or people in certain career fields that, went on in their careers without mentioning it to their bosses or their coworkers until recently. And so I'm noticing that the way that sickle cell is being introduced into the industry in different areas is making it more inviting for people to speak up about it. Like we have a lot of TV shows now, like Supercell, and they're dropping it a lot more.
Series.
Yeah.
That was
more than just before. You might hear a little bit in a medical show, but now there's shows like I don't know, one of the Power series where they're bringing it up in shows you wouldn't even think sickle cell is going to come up in. And so I think it's really opening doors for us to be able to speak more and be confident in our illness and what we're battling with.
That's fantastic. And Yvonne, what inspires you about the future of sickle cell?
I mean, beyond listening to these two,
right?
First of all, Clubhouse was definitely a throwback. I forgot all about Clubhouse. And I have written down Sickle Cell Sundays. I am definitely going to take a listen. I mean, honestly, the future, honored to be here, honored to be on the walk. And I'm just inspired by all of the patients who are using their voices and the healthcare providers that are supporting them. I say at Nova Nordis, I'm excited about some of the things we're working on. One of the things we're proud about is a disease awareness campaign called Live Unlimited that will be coming out shortly. And really the intent is to talk about the powerful future of people with sickle cell disease when we break down barriers, where we eliminate the challenges to access, and then there's real progress made. And our intent and hope is that it uncovers some of the stigma and bias that exists, that we can educate those who need more information, but really to celebrate and highlight the triumphs that these people have overcome and just the experience that they have taking control of their lives where they have the opportunity to do so. And so in a very significant way. So more to come on that, but I think it's going to hopefully spark meaningful conversation. And in this space, I feel like what we really want to see is ignited action, right? We want to challenge perspectives. We want people to understand, to learn what it means to live with sickle cell disease, but then also to say, well, what is my part to do something different? So I'm also equally excited about where sickle cell is headed, and, just honored to be able to hear the both of you speak about that experience firsthand. So.
Absolutely. So, I think that's really the key here. And as we go into sickle cell, as we wrap up Sickle Cell Awareness Month and everything, I just Tola, what do you want people to know, I guess, as we move forward? Is there anything people could do, a special message or anything? Or is there a way that people could advocate, or take a lesson to somebody, or maybe just be more understanding of someone who has sickle cell? I know you mentioned a lot of times there is a stigma that people sometimes have. If there was something that you could say to someone who works with someone who has sickle cell, or is a classmate of someone that maybe they just don't understand, and for whatever reason doesn't seem to take their pain seriously for whatever reason, what is the reason why people don't quite get the pain of sickle cell? And I guess, how would you kind of maybe override that or explain to them, just because you can't see it doesn't mean that we're fine?
Yeah. I think it really is an invisible disease. Like, I don't look like any of the pain that I'm feeling now, and I definitely don't look like anything that I've been through. And that's common for a lot of warriors, because we've dealt with the pain for so long. We're very good at putting on a poker face to get through the day. So having grace for people and knowing that you'd never know how this person is feeling or what they're dealing with beyond the pain. Like, a lot of us have like a form of PTSD from dealing with the pain. Like, one day you might be perfectly fine and out and about on a vacation, on a flight, and boom, you're having a crisis, and now your world is flipped upside down. And so having grace and knowing that they may look okay on the outside, but physically or mentally they might be dealing with a lot. So giving them grace makes a difference. I know for me, like, when there's like random acts of kindness, I'm like so grateful, because those people are like so nice to me in a moment where they may not know I'm actually struggling right now. And you just taking the time to being nice and having grace for me in that moment, not knowing what I'm dealing with, goes a long way and helps, with what we're already facing.
Gotcha. And Dr. Patel, any final words on just maybe for fellow, healthcare providers, for when dealing with patients that have sickle cell, just in terms of maybe being more understanding? Or
I mean, I think it's exactly that, right? Having grace and listening. I think that goes a long way. Even if you haven't gotten all of the training that's needed to really understand the disease, listening to your patients, caring for them, being as empathetic as possible will speak volumes. And, I think it will be a benefit to the community all around.
excellent. And Yvonne, final words. What do you think from a health, in the healthcare space, being an empathetic provider? What do you want people to know about?
Yeah. Well, I think the first thing I would want people to know, quite honestly, is, sickle cell is not caused by the person. It's not their fault. And, it's a genetic condition. And I think sometimes people don't even realize the simplicities of the clinical aspects of the condition. So I think that is the first thing. I would say having understanding and patience for people. And quite honestly, it's simple things like asking, how can you help? So I wish there would be more of that. And because as I hear Tolu talk and others, and, Kristen, you and I were at the same patient conference, and you hear stories, and it's heartbreaking. And so, just to listen to people's journey and their experience, I wish there was more of how can I help and what do you need? And being a little bit more patient and empathetic for people who are going through.
Agreed. Well, I can't think of a better way to wrap up this Facebook Live, to wrap up the end of Sickle Cell Awareness Month. I thank all of you for being here. I think we shared so much information. I think the three of you are really helping to change the paradigm for sickle cell disease. Thank you very much for being here, and have a great night.
Me too.
Thank
Thank you for moderating.
Thank